All right, good morning, everyone, and welcome to City Hall. As we were attempting to do a little social distancing, remember, that's 3 to 6 feet, and I'm hopeful that those of us in the crowd here will start to, at least pay attention to that. But I'm joined here with our Council President, Mike Cater. I'm joined with members of the City Council, Councilwoman Sinead Williams, Councilman John Rubo, the Minority Leader, City Council, Mike Breen, and of course, Councilwoman Tasha Diaz. And we're here today, along with many of the commissioners, the Police Department, Commissioner Muller. We have a Parks Department, Commissioner Landy, Kelly Chiarella, who's in the crowd, who's operating the Office of Aging, members of the Health Advisory Board, led by Dr. Rabati, Susan Taylor, who is also with the Yonkers Public Library. So today I wanted to gather our city officials together and our school superintendent, who's with us, Dr. Quezada, who you'll hear from in a little while, to provide our residents with an update on this growing pandemic we all know as the coronavirus and its effects on our community. Given the size of our city, the proximity to the epicenter of the Westchester outbreak, which is just to our east in New Rochelle, Yonkers has really been very, very fortunate as not to have been hit that hard by this virus, at least not yet. However, as the days become weeks with this outbreak, we will probably more than likely see a rise in the number of cases. The Department of Health notified Yonkers just yesterday that there are about 6 people who are confirmed to have the coronavirus in our city's borders. But I want to point out that there's been no direct, at least up until today, there's been no direct confirmation case in our public schools, and that's real good news. And that's why, for those of you who are on social media or who might want to talk about this, I think there's been a lot of people have been wondering why they're not hearing bad news. Well, that's because there isn't bad news to tell them. And but as soon as we have some, I'll be certainly one of the first to make that available. So let's be happy about about what we're seeing happening in our schools. We know that it will eventually affect us. It will eventually affect our schools. So in our ongoing efforts to contain, to slow down the spread of this virus, Yonkers will cancel non-essential programs. Our facilities will do everything we can to limit public interaction amongst our residents, especially the ones that are involving the high risk of contracting this virus. So effective immediately, the city-sponsored programs will be canceled through March 27th. That week, the week of March 27th, we'll reassess and we'll decide how we're going to handle the next 2 weeks. But that will include the recreational parks, all of our senior programs, Murray's Rink, the mobile tax office, the public programs, and our libraries. Though our libraries will remain open, but the public libraries will be, the programs will be suspended. We will continue to provide our nutritional programs for our seniors. That's important. We certainly want to make sure our seniors are getting the support they need. And to limit the need for residents to want to come to City Hall, we're going to do a number of things. One of them will be that for people who pay their property taxes or their water bill online, there's a 2.5% fee that the city charges. We will be sending those fees back to anyone who wants to pay those fees online. So essentially, there'll be no charge for utilizing the internet to pay your taxes or to pay your water bill. You can do that by going on www.yonkersny.gov. There are a lot of questions about our schools. Dr. Quezada and I meet not just daily, probably 3 or 4 times a day daily. We have been on the phone and a part of many of the different daily conversations that are happening with the state of New York, with the municipal officials in Westchester County, with the State Department of Health, and certainly the County Department of Health. Before I go any further, I'd like to ask the Superintendent of Schools to address us a little bit and provide an update to all of you on our schools. And also ask that hold your questions until he finishes at least his statement. Thank you.
Thank you, Mr. Mayor, and good afternoon, everyone. First of all, let me say thank you to our mayor for bringing us all together this afternoon to provide an update to our entire community. My board president, the Reverend Steve Lopez, is also here with us. And I think it's important to note that addressing this crisis is not a school issue only, but it is an issue that affects our entire community. And therefore, it is extremely important that we are all together. Ultimately, it's about ensuring that everyone is safe. Please understand that the safety and well-being of all of our students and staff is our top priority. As the mayor indicated, as of now, we do not have a positive case of coronavirus that is directly associated with our schools. However, with that said, you must understand that the decision to close our schools is in the hands of the Department of Health in collaboration with all of us here in the city of Yonkers. You must understand that we are working directly with the Department of Health to ensure that every case that is presented to us is investigated and that we obtain as much information as we possibly can. With that said, I want to encourage the community that if they know anything about a potential case, please call our offices. If you are a parent of a child, please call the building principal, who is responsible for reporting that information to my office and to the medical office in the Yonkers Public Schools. We do want to continue to support our students, and fortunately, our schedule allows for me to call another superintendent's conference day. So tomorrow, the Yonkers Public Schools will be closed for students only. The purpose of closing the school tomorrow is to prepare additional instructional materials for our students so that in the event that we need to close schools for a prolonged period of time, that we have the instructional materials so that instruction may continue for each and every one of our students. As you all know, the prolonged closing of any of our schools will not only disrupt the families, but it will disrupt the entire city. So we want to make sure that we are ready, that we are working collaboratively, and that each and every one of us is ready to support our children. Please understand that as we close schools tomorrow, we will also engage in additional cleaning using the products that are allowed by the CDC, and they are all listed on the CDC guidance. So once again, we will be closed tomorrow for the purpose of additional cleaning for our schools, and most importantly, to prepare additional materials so that our students will not miss an instruction. We are working very closely with our bargaining units so that we are doing what's best for our young people and our families, and most importantly, so that we demonstrate that as a city, we are always ready to collaborate. Un pequeño mensaje en español a todas nuestras familias. Familias, recuerden que nuestra prioridad es la seguridad de nuestros estudiantes y de nuestros miembros de la facultad. Mañana vamos a cerrar por un día para tener más materiales de instrucción para nuestros niños y para continuar limpiando nuestras escuelas. Hasta ahora no tenemos ningún caso confirmado asociado con el virus corona, así es que nosotros podemos seguir teniendo nuestras escuelas abiertas. Entiendan, padres y miembros de la comunidad, que el cerrar las escuelas se hace en conjunto con el Departamento de Salud. Asegúrense que lo mantendremos informados y esperamos que las escuelas sigan abiertas por beneficio de nuestros niños y beneficio de nuestra comunidad. Thank you so much.
We'll come back. We'll do questions and answers at the end. In the meantime, I'd like to ask our council president to come up to say a few words on behalf of the city council.
Thank you, Mayor Spano. Thank you, Dr. Quezada. I've been in contact, obviously, with City Council leadership. We have Minority Leader Breen here and Majority Leader Corazon Pineda Isaac. While we're on in legislative session, the City Council will continue to meet twice a month pursuant to charter, but I have spoken to all council members and asked that they postpone, delay, and not hold any committee meetings until further notice. It's important that while we try to contain this issue and try to limit contact to City Hall, it will be counterproductive to have committee meetings and other events, bringing them in. We can't have both at the same time. I've been in contact with the city clerk, and we're going to implement a skeletal staff in the city council president's office and in the city clerk's office. There's a balance of trying to be cautious, protect our amazing employees and our residents, but making sure that the city function, city government is running. The situation is fluid. The city council is working hand in hand, no pun intended, shoulder to shoulder, Mayor, with the administration and the superintendent. And residents need to know that your government is functioning. We're in full force. We're aware of the situation. However, we must remember the situation is very fluid, and no matter what is presented to us, we will be prepared to combat it effectively and efficiently. Thank you, Mayor Spano. Thank you, Dr. Quezada. God bless the United States of America and the city of Yonkers.
Thank you, Council President. I'd like to ask Elise to say a few words for us as the head of the Health Advisory Board to the Mayor. Dr. Rabati, please to offer some words.
Good afternoon, everyone.
Good afternoon.
On behalf of the Health Advisory Board and the new chairman, Dr. Samarne, thanks for giving us this opportunity to speak to the public. Let's walk step by step quickly. Let's say you feel like you've been exposed to the COVID-19 or having symptoms or know someone that's been in contact with you that's been diagnosed with the COVID-19. The first thing you should do, please listen clearly, is quarantine yourself. Stay home. Stay in a room by yourself, away from your family. Call your primary care doctor. Do not go to the emergency room. Do not go to your doctor's office. Call your doctor. Listen to our advice. We have certain questions we've been trained to ask to try to narrow the field down and to see who truly is a possible suspect of the disease. Once you've been quarantined, if you have symptoms of fever, headache, cough, shortness of breath, those are the 4 main symptoms. You contact us again, we will direct you exactly what to do from there. I'm not going to go into all the steps right now because we're limited with time, but please remember, do not go to the emergency room. Do not go to your doctor's office without calling first. St. John's has a hotline at 914-964-4706. That's 964-4706. If you feel like you are coming down with the COVID, you call that number at 964-4706. That's the Corona hotline. We'll have specialists meet you outside and bring you into the hospital. Do not come into the emergency room. Thank you, Mayor.
Thank you so much. And just so you know, too, the city departments have established business continuity plans that will allow us not to disrupt necessary services that will be provided to the city's residents. And as always, we'll continue to keep you updated. A couple of quick things though, too, just to recognize, you know, I don't want to minimize this virus, but it's important that we, especially as your elected leaders, just put it in perspective. You know, the reaction that we're seeing out there is substantial, and it's scary. It's scary to a lot of people, and I get it. But you have to understand that what's happening here, the city's school district is moving remarkably well. The teachers are educating our kids. Our kids are going to schools every day without interruption, and that's a good thing. That's a credit to our superintendent, to our trustees, to our teachers, and all the support staff. Your city services, remarkably well. All the first responders, full complement of police, full complement of firefighters, the EMS services and Empress have been upped, and so there's additional support staff, and we are all working together collectively in an effort to make sure that we can do what we can to slow the virus down. We slow it down because we want to make sure that during this time that the most vulnerable, the seniors, and those who have compromised immune systems are have less of a chance of being affected by this disease. But for the most part, we will all get through this. Many people will get this virus, we won't even know they have it, and we'll get through this, and we'll get through this fine. This city, this country, has faced far worse threats than COVID-19. With that, I'll want to offer to see if anybody has any questions. Yes. Anybody? Yes.
I just wanted to double check what you said. Of the 120, whatever the current number is, people in Westchester County who have tested positive, you're saying 6 of them are residents of the city of Yonkers.
That's correct.
Have they been traced back to the original patient?
We have not gotten that information from the Department of Health yet, and I've been a little critical of the Department of Health and their inability to make information available to the local governments. But this is, everyone's writing a new chapter here. We're prepared for terrorist attacks. We're prepared for hurricanes and blizzards. This seems to be a new one. And so,
have they told you what part of town they live in?
no, they have not. But it is something that is coming shortly. We will know. We're not going to. We will know, and we will make sure that those who, especially our first responders, who have to deal with this on a day-to-day basis, are provided with that information at the same time, making sure that we protect the privacy rights of the individuals who may have it.
Well, Mayor, you can say definitively those 6 people have no direct association with anyone in Yonkers.
I can say that. Yes.
What's that?
When I say definitively, that's if there was ever a Board of Education connection, it would have immediately gone to Dr. Quezada. So at this point there is no connection. And I've been assured of that by several different sources.
Can I ask Dr. Abadi a question?
Sure.
In my travels, I'm a little surprised at the number of senior citizens, people well into their 70s and 80s, picking up dry cleaning, stopping to buy lottery tickets, going here or there. If I have a mom, and I do, 82 years old, should I be encouraging her to stay at home and avoid going out? What is your best advice at this point?
Ironically, my mom is 82 also. My advice to my mom is stay home, try to decrease as much contact as you can. And like the mayor said, we do have 6 cases. It's inevitable. It's going to be, Yonkers is the largest city in Westchester, and Westchester right now is the hot zone. But as of now, we can confirm at both hospitals we do not have any positive cases yet. But again, it's inevitable. It's going to happen in the next few days. We'll see some positive cases. We're ready for it. To answer your question, minimize as much contact as possible. Sanitize as well as you can. It's a proven fact. When you sanitize, it decreases viruses.
And just to follow up on that, obviously concerned about the health of every resident in Yonkers and in Westchester and New York. But the goal of minimizing the infection in the older population is to minimize the impact on the hospitals, right? And the concern is that seniors are more likely to get very ill and overwhelm the healthcare system beyond its capacity.
There's some truth to that. The hospital can only maintain so much, and the elderlies do have a higher risk because of comorbidities and a decreased immune response, especially with diabetics and other comorbid diseases. And to answer your question, and you kind of answered the question yourself, is minimize as much contact as you can. The elderly population should be extremely careful going to senior groups and functions like that. We saw the NBA yesterday shut down the entire, I think that kind of set the tone for the rest of us here today.
Dr. Quezada, I have a couple questions for you.
Sure.
Was this superintendent's conference today something that was planned already in advance? How often do you do this?
So the district is allowed to have 4 superintendent's conference days. We had only used 3 of them. So no, this was not something that was in the original schedule. but it's something that if I have the dates available, I am able to do.
And you said you're going to use a part of it for additional instructional materials. Are you planning to maybe move classes online when it comes to that?
Well, we are already ready for electronic instruction. Soon we will have a link in our website that would allow students and parents to go directly to our website, and we will have 14 days of instruction in that particular link. However, one of the things that I want to be able to do is to create lessons that are on-time lessons. What does that mean? If you are a classroom teacher and you are teaching a particular topic, let us have lessons that we can send to our students that are directly related to that topic, as opposed to having a general lesson for our students. We want to be as interactive as we possibly can. We want to use e-learning as much as we possibly can. However, we recognize that we are in an urban community. Not every student has access to Wi-Fi. Not every student has a laptop or a computer at home. So we are also ready to provide hard copies of lessons to our students if we need to close schools. I want to give a reminder to everyone that I failed to do. All of the building permits using our schools for outside organizations are canceled. We are not allowing any outside agencies to come into our schools at this time, which is very unfortunate because we want our students and our young people to be active in the afternoon, but at this time, we do not want any outside organizations in our schools.
Just one other question. How many schools are in the district and how big is it? How many students are in the district?
The district is about 27,000 students as of now. We have 39 schools. Actually, we have 40 buildings where we have children. We are a large urban district that is performing well and is now dealing with this unfortunate situation.
Dr. Quezada. So I previously talked to your food director, and she said about 75% of your students are food insecure. What is your plan if you have to cancel school in the long term to provide these meals for these children?
So as of now, we have preliminary plans that would allow us to have at least 6 different sites where we can provide breakfast and lunch to our students. Right now, I have enough supply to provide about 3,000 lunch and breakfast to our students. However, we are consulting with our vendors to increase the number of students to whom we can provide breakfast and lunch in 6 different sites. And if I need to open more sites, I'm preparing for that as well.
You could expand and you said outside agencies. Give us an example that you found.
Well, our buildings are open to the community. So as a community agency, a club, and you wish to use our schools, we can actually give you a building permit and you can come and run your after-school basketball, Boys and Girls Club, and any other programs that will enhance the life experiences of our young people in our city.
Have you seen any decreases in attendance?
Absolutely.
Like how much?
Absolutely. So as today, the attendance rate for the Yonkers Public School is 93% or higher on a daily basis. Today our attendance rate is only 83%. So that's a 10 percentage point reduction in attendance, and certainly parents are the ones who need to make the best decisions for their children, and we will respect that. But we are trying our very best to keep our kids in schools.
Now, Mayor, is there any plans to close the Yonkers Public Library?
At this point, there are no plans to close the Yonkers Public Library, though we have canceled all the programs. One of the things, to go back to your question too, about our kids who are going to need the nourishment that they should get, that we're going to provide, we will work in a collaborative way. We have to. The city's efforts, or the Board of Education's efforts, will be combined with the city, and we will make sure that this is done. We'll make sure that those who need to get the meals get that. At the same time, we'll do what we have to care in education. Just to go back to the end, since I think we're at the end of this press conference, just remember, we all have our own way of doing things. In other words, we can do a lot just individually to prevent the spread of this virus. You know, avoid big crowds, practice social distancing, unlike what we're doing here, and of course, wash your hands. Wash your hands, wash your hands, wash your hands. And like I said, you know, Antonio Yellow talked about, you know, 80 somewhat year olds. You know, I had a long conversation with my mother, who's 86 years old. And, you know, I don't want to tell you, she doesn't think it's a big deal. She's like, I've been through a lot worse than this. I said, Mom, you need to stay home. And so we will, and so that's what I think you deal with that generation. And maybe there's a little piece of that in terms of the attitude that we all need to take part of, but at the same time, make sure that we do everything we possibly can to protect all of our families. So with that, if no other questions, we'll just wrap it up. Thank you.
Classes are back to normal on Monday, unless, you know, the Department of Health determines differently. But as I said before, we don't have any confirmed cases in our school, so we expect for classes to resume on Monday with no interruptions.
Thank you, everybody. Thank you. Thank you.
Sorry. This is cold. Makes me have the sniffles. Don't say that too loud.